What's good, everybody? Sherman Webb-Middlebrooks, lifelong Buffalo resident and full-time Black man here with a dope episode of Igniting Hope Radio. Today, I got, as you can see, three dope guests, that we're going to have. Excited to have them pull up and talk about our event that we're having, Research in Action, this upcoming Thursday, July 30th at Canisius College. The purpose of this event really is to bring research out of the institutions and back into the community and get community to be more involved and engaged in research and really help set up the small businesses and the community-based organizations to be able to write better grant proposals and tell better stories, to be able to effectively communicate the effectiveness and the impact that their programs, projects, or small businesses are having. So if that interests you, if that fits you, you need to be in the building with us next Thursday from 2 to 6. So without further ado, I want to go ahead, get things started. Our guest today, I want to start off with introducing Dr. Renee Kadzo. Dr. Renee is an assistant professor in the Division of Health Services Policy and Practice within the University at Buffalo School of Public Health and Health Professions. She also serves as co-director of the Recruitment and Special Populations Core at the UB Clinical and Translational Science Institute. Her work includes supporting community engagement, community health workers, and stronger partnerships between researchers and the communities that work is intended to serve. Thank you for pulling up and cutting some time out of your busy day. I was able to get three professors on a call at once. So the universe is working on our side, because it's definitely difficult to do that. So the next person who I want to introduce on our panel, because I want to get to the conversation, is Dr. Catherine. How you say your last name?
Leigh-Osroosh.
Leigh-Osroosh. Okay, I like that. That feels good to say. Okay, so next up we have Dr. Catherine Leigh-Osroosh. I like saying that, and she is an assistant professor of school counseling in the University at Buffalo Department of Counseling, School and Educational Psychology. Her research examines how social justice can be meaningfully practiced within counseling and education. She uses qualitative methods to explore the lived experiences of historically marginalized community across education, mental health, career development, and the social determinants of health. So again, I appreciate you pulling up, and I know you got somewhere to be at the top of the hour. So definitely thank you for carving out some time in your schedule. And last but not least, is the good doctor, Dr. Christopher St. Ville. He is an associate professor at the University at Buffalo School of Social Work. His research focuses on trauma, violence, victimization, masculinity, health, mentoring, and the experiences of young people and Black men affected by violence. His work also examines how older adolescents and natural mentors can positively influence young people and help strengthen communities. So appreciate you, Doc, for pulling up. And then, man, I think y'all know me by now. If y'all tune into the podcast, I run the Men's Mental Health Project over at the Center for Health Equity, and I'm also the founder of the WIN Initiative. And so my work really focuses on capturing and amplifying youth and community voices, which is why we're here today. So let's go ahead and get started with our main question that I want to put out to the panel, and I want to hear from each one of you. When people hear the word research, they may imagine complicated statistics, long academic papers, or people just studying communities from a distance. How would each of you explain research in a way that feels practical and accessible? Renee, we'll start with you.
Sure. I think research is really just taking a systematic or a consistent approach to collecting information about a topic. So you want to know if an apartment that you're looking at in a neighborhood is in a safe and healthy space. You can do research by collecting information that has been collected by other people. So that would be kind of like what we think of as secondary research, right? You're collecting information that's been documented already by somebody who's tallied the health effects or the economic benefits of being in that space. So research is really all around us. It's all about systematically collecting information and then using it to answer a question. And it can be about any topic. The world is a research laboratory in many ways, right?
Word. I think that's a dope perspective. Me with my bachelor's in psychology sitting here with you professors, I just know the impact of how that bit of training that I've had definitely changed my outlook. It's like you can't unsee certain things. Everything you become skeptical, you want to understand everything. And the whys and really from a trauma informed perspective too, I think makes you inquisitive as to the what happened instead of thinking about what's wrong so much. You want to know what happened. Katie, talk to us. Tell us. I'm sorry. Yeah, talk to us.
Yeah, building off of what Renee said, I tend to think about research as relationships. I do a lot of work with Indigenous scholars. I myself am not I'm biracial, but my work does a lot with the Indigenous community, and so from like a decolonial, anti-colonial lens, it's all about relationships. And being a qualitative researcher, it's very much that. So
Mm,
like you want to know the why and the how. Much of that is like, okay, how am I showing up in this space, and how is my approach to whatever it is that I'm doing impacting others, impacting systems, impacting phenomenon. And then if I'm doing it with a team, right, which is where we're headed with like community based work, then it's not just my bias coming in, but I have a collective. And so through that collective and through those relationships, we create something. So it's studying what's happening or what has happened, but also at the same time, you're living it and you're in it. And so those relationships are really key in the work. And it's all about that impact is relational. And it's regardless of if it's qual or if it's quant. We tend to think of numbers as very static and very much like, you know, exclusionary or kind of on the outside looking in, but numbers are very relational as well, right? They tell stories. So I'll end there, building off of what Renee was speaking to.
yeah, I love that idea because numbers do tell stories. And I would always say, like, if you have individuals who can articulate lived experience, and then you also have individuals who can put numbers behind those narratives. When you walk into a room and you're asking for dollars or you're advocating or you're even just trying to bring awareness, it's kind of hard to deny that approach when you're able to approach it with the narrative and the numbers. So, Dr. Saintville, talk to us a little bit about your approach to research, and I know you've done some community work as well. So talk to us a little bit as well.
Yeah, building on what Renee and Katie said again, as Renee said, collecting data in a systemized kind of way, like figuring out a plan on how to collect some data on a question that you wanna answer, and then of course you're trying to do it with the community, like Katie said, and do it impactfully with the community. But what I want to add to build on what they said is like using that research and using that data collection to actually try to change policy, right?
Hmm.
To actually try to make change in our community, and that's what we found. Like, that's what I guess we've been trying to do for a minute. The Health Equity Research Center, y'all been trying to do for a minute now. When I think about, the kind of research, you know what I'm saying, that changes policy, I think about the Love Canal, right? And the
Yeah,
work that lady out there did to try to prove, like, yo, people's basements got this green ooze coming out of it, like Teenage Mutant Ninja Turtle,
for
but y'all don't want to
real.
about it, right? So she went out and collected information about that. I think about the Black Panthers, right? They're trying to figure out a need in the community. The kids wasn't eating, they going to school hungry. They figured out a way to collect data and came up with the whole breakfast program, which is now a national program around the country. You know what I'm
Hmm.
saying? So so research for me is collecting the data on issues that matter to you. You know what I mean? And then being able and then applying that data and using that data to change your reality, which for us means changing policy.
Yeah, yeah, that's dope. And I love that approach. So you gave some really great examples. Some real local ones, but also some real historically national ones as well. To Renee, I guess my follow up question, and for each of you as well, just because I know you and I have done some trainings for policy and decision makers, but also people who are impacted by policies, and you are the person who I always credit with introducing me to the concept of community-based participatory research, right? Where people were doing research in community or engaging in research like activities without even knowing it. So can you give some examples of some work that you've done or some examples that you've seen in the community where people are doing research or research like activities without even really knowing it, and how could being aware of that impact their effectiveness of their program?
Yeah. I guess first I'll kind of define, traditional research often is like a researcher, a group of researchers comes up with an idea and they say, I want to find the answer to this. And they kind of go to community and they say, oh, we think you have high rates of diabetes. We're going to work on this issue with you. Okay. Whereas community-based participatory research says, hey, what's going on? What do you want to work on? Are there some things that you want to see more of? Are there some things that you really identify as issues in your community? And who should we pull together to work on this issue? So I can think of like examples, one that I wasn't involved in, but I think, a really relatable example might be a playground or a soccer field that is plagued with like trash and maybe some of that trash is dangerous, and the community really wants to be able to go there and play soccer, but they can't. So they document, the times of day, the contributors to the trash, or perhaps activities there that are not desirable in a healthy neighborhood, right?
Right,
They
right.
document all those things, and then they figure out that, oh, if we put in some additional street lights, if we have people that come by and clean it up every now and then, if we actually paint soccer lines on the field, these are the things that are going to contribute to a healthier use of this space. So that's just like a very organic way that communities will do research and then advocate with their policymakers for the funding or the resources in order to transform a space. And then you can also look at, well, how did that affect the quality of life of people that live near that space?
Mhm.
That's an additional question you can ask of it. So then you could do a door-to-door surveys, or you could, have a community meeting or a town hall where you get feedback from people about, the impact that now more green space has on their lives and their ability to be physically active or join together for picnics or things like that. So that, I guess that's what comes to mind when I think about a community-based effort that could be framed as research and may have involved researchers in the process of doing that.
Yeah, that's dope. And I think people organize and do stuff like that all the time, but without that awareness, being able to tell that story, I think, again, I'm all about capturing, amplifying people's stories and getting folks who aren't at the table to have a seat at the table and understand that they deserve to be at the table. Dr. Katie, talk to us a little bit too about some of your experiences as well in the community, working with people and maybe bringing them to the light that they were doing research without knowing it, or how you've been able to help people with their research, tell better stories.
Thank you. So I'm on the earlier end of the research using CBPR. So, this is my move back to the area in 2022. And so it takes time to build relationships. And there's been a few, community partners that I've been working with. And it's really been about learning first and foremost, like what's going on. And so, the early work is really just getting to know folks, showing up at meetings, listening in, saying, okay, this is what you got going on. How can I support? And it's really what I'm finding is it's a lot of capacity building. And as a researcher, for me, that means like I'm taking a step back, and being patient because the project's not ready to get up and go in this moment. It's going to require some time and some skill building, which is what this workshop is, right? And making sure that folks have an understanding of like, okay, what is it that you're doing? Because what I've found is a lot of folks, they have their mission and their vision, and then they have these programs, but they get involved in mission creep. And so sometimes
Mm,
the conversation is about like, all right, so you're doing all of these things, let's hone in on like the one or two programs or three programs that are really getting folks engaged, and what's working. So more evaluation in the beginning, and then as you work your way through, like you can dive into more of like research, like how is it impacting. And that's also the thing about community-based work is that like as a researcher, sometimes when we talk about it, colleagues will say, oh, that's not research, it's evaluation. And so those two sometimes can go hand in hand when working with community members as well. And that's more for us on the research end of the spectrum to, discuss and kind of even out with our colleagues at our institutions. But with the community, it's all about listening in, what's going on, and then how can my skills best serve you? And if not me, is there someone else in my network that could support you? So also really doing my best not to, you know, say this is my partner and I'm only the one working with them. Um, get possessive, and there are some folks who can be,
mhm.
but
No, ain't that the
sharing
truth?
the wealth, yeah, but sharing the wealth with our community, partners and in our networks.
Mhm.
No, I definitely appreciate that as well. Go ahead and readjust that. So you're really talking about the idea of having people who are engaging in research treated as partners and not just like participants or numbers on paper. And I think like that's, given historical context in this country, insert traumatic historical event here, I think is crucial when you're building a relationship. So, Dr. Chris, what I want to bring to you is the same question, but also having known and been in spaces with you, seeing how your connection to community impacts not only just the research areas that you look into, but also how you show up and present yourself and doing research. Because I remember plenty of times being in spaces with you, working with mentorship programs in the community, and people had no idea who you were, what you were there to do, which I think goes to speak to your level of being ingrained in the community and not showing up and presenting as somebody with a clipboard trying to just observe and report, but really getting in there with folks and being part of what's happening amongst the participants. So talk to me a little bit about your experience doing that with the community.
Yeah, so like most of my experience has been trying to demonstrate how the community themselves can engage in the research on their own. Like y'all don't need me to be around. Y'all can be asking people questions and compiling your own data, right? And so, one example of this is when I was working with Devon, who's running. Devon runs the what's that spot he run over there now? I forgot. CEO or something.
Oh, you talking about Brother McCune over at the King
Yeah.
Urban Life Center?
Yeah, he run the Urban Life Center now, right?
Yep,
So
yep.
back in the day when he was a BCAT and I had
Yep,
just got
yep.
up here, we ended up doing the students helped us put together a survey because they wanted to find out what was students doing, like how was they spending their free time after school? You know what I'm saying?
Okay.
And so they wanted to figure out and get some information from the students so they could figure out like how they could try to like strategize around how to try to get kids to different events and the different places around the city, whatever. So we had a couple kids that helped us put together a survey, and they went out and administered the survey themselves at the bus stations, at the schools, after school, and in different public spaces. Another example is working with breaking barriers, right? With Brother Daniel and Pastor Tommy and Jamie.
Yep, yep.
There was an issue going on in the city, right? Where I think bus passes wasn't allowed to be used after a certain time. So like, I think the bus passes was only able to be used in so when school ended, that's when you couldn't use it no more, right? And then so they basically the Breaking Barrier boys, man, that was an issue for some of them, and they didn't want to do something about it. So we helped them put together a survey, and then they went out and asked dudes, you know what I'm saying, their peers about, you know what I'm saying, public transportation, how much of an impact not letting that bus pass work past school hours actually impacted them and their families financially and stuff. And then we took that information from that data collection and those boys presented it to the board, to the education board themselves. You know what I mean? So once again, I'm always trying to put myself in the position, you know what I mean, to like help them figure out how they could continue to do what we already doing. You ain't gotta wait for me, bro. Like y'all to collect your own data on whatever issues matter to you, whatever issues matter to the community. You know what I mean? I could come in and help them tighten it up, but y'all can figure it out. Like y'all could start. And this is data collection. This is research. It's a form of research, right? And once again, collect the data to try to solve problems in your community. You know what I'm saying? Collect the data to be able to tell a story about how a problem looks in your community, and then taking that data then to then find solutions. You know what I mean? And so, yeah, you've been real good about it. And that's what this whole joint about that we finna do, right? It's about talking to organizations about, you ain't gotta wait for the PhD researcher. You ain't gotta wait for a grant to cut through. You ain't gotta wait for a dude that you think is smarter than you to come through. You could jump on, open up some computer programs and start collecting this data on your own. You know what I mean? And then, yeah.
Yeah, no, that's dope. And I love when you had that perspective. I remember you was telling me one day when we were kicking it, you were like, yeah, like, you know what I'm saying? Dudes go home and they play Madden. I go home and play Microsoft Excel. Like, that stuck with me. Like, yeah, I don't play PlayStation, I play Excel. Like, you can play Microsoft Excel too. It's a video game. And I was thinking like, man, that perspective is just too clear to like deny or say anything back to. Like, he got it. Like, I totally understand. But thinking about like a small organization or a small business, they may not have the research department or a full-time evaluator, like to the point that you're talking about. So increasing capacity, which is what I think each one of you are essentially talking about as well. And me, myself, that's the idea of this. So moving into like kind of like what we're going to be doing on this upcoming Thursday at our event, like really just because a small organization may not have like a research department or a full-time evaluator, but that doesn't mean that like research can't properly be documented. And I think that's what everybody is talking about, really increasing capacity in the community for organizations and on the individual level. So what should a small community organization know before approaching a researcher about like a possible partnership? And like, is there things in terms of clarifying the goals of the program, identifying community needs, creating surveys or evaluation tools, and how do they show that things are effective? So what should like a small organization, business, or individual know before even approaching one of you guys? Kind of like to the point Dr. St. Jill was saying. And we can go ahead and start with Renee again.
Yeah. I mean, I think just having kind of a clear ask is helpful. I mean, so, sharing kind of the mission and vision of the program, maybe how it's funded, if your aim is to seek additional funding, who your primary participants are, like what populations you're working to serve. Those sorts of things are really helpful to know. And then what your hope is in terms of working with a researcher. Do you want to collect quantitative data? So I think Katie alluded to quantitative and qualitative before. So do you want to hear the stories and collect that in a systematic way, or do you want to count the occurrences of something in some way? So I guess having a sense of what kinds of information and what format of information you're interested in. So I guess that's a good place to start, and it's probably helpful, at least a little bit helpful, to understand what kind of researcher you're looking for. So are you looking for somebody who will be primarily looking at psychological things or social things or healthcare related things? So trying to identify the right researcher through their discipline could be helpful too.
Yeah, that's a good point. I don't think I ever really thought about that. Dr. Katie, what say you on this?
Yeah, they covered it. I agree with everything that she shared, and I think I would add the question I tend to ask folks at different stages of the process is like, what are they most curious about?
Mm.
Because it's yeah, the impact, yeah, the data, but again, kind of going back to that like consistency. Like sometimes you have great ideas, but our execution of it isn't really lining up with what the idea was or like what we're hoping to see. And so that question, like, what are you most curious about knowing? And then like, what's the impact? So going back to what Chris was saying earlier about policy, right? Part of the participatory process is identifying those power structures. So like, part of that process is like, who are the key players in the organization's network that are with you and that support you, or that are going to be like barriers that we need this data to like convince, right, to change this policy and to change this or procedure. If you think about education, a lot of times like it's a procedure that folks are wanting to change or students are wanting to change. So yeah, so what are they most curious about, and what do they want to see change?
Yeah, I like that idea. Stay curious. Definitely stay curious and dream with your eyes open, basically. I like that. Doc, what about you? What would you say?
Any organization of any size can come to any researcher at any time at any point at any point of the spectrum of their research stuff, and the research will be able to help them at the beginning, at the end, or the middle. Any researcher will be able to do that. But like, I guess what I'm probably gonna kind of push organizations to do is, yo, you should probably be collecting something for you even come to me. You know what I'm saying? Yo, come to me. Don't come to me butt naked like, yo, what should I do? Come to me with, yo, this is what I did, and then we can move from there. You know what I'm saying? Like, and then what you should be doing, what you should be thinking about as a program. When I think about most of the programs in Buffalo, I think about MVP, I think about breaking barriers, I think about, you know what I mean? All these different programs. The first thing you need to capture is how many people you dealing with, how many people you serving. So collecting demographic information, first name, last name, age, you know what I'm saying, and whatever other sort of demographic information of the individual that's going to help you figure out how to help them more. That's the first step. And then after that, you know, if you think that if your program is actually having an impact, then how do you know that your program is having an impact across these people that you are serving, that you're collecting data on already? So are you trying to impact their depression? Are you trying to make them less violent? Are you trying to make them, you know what I mean, get better grades in school? Whatever. But how do you measure how your program take this participant from A to B? You know what I mean? And that's really the sort of data you need to be collected. You know what I mean? And so at bare minimum, demographic information, age, gender, you know what I'm saying? Stuff like that. And then after that, what is the impact that your efforts are supposed to be having? And then you think about how you want to measure how you prove that your program was making that impact, and then start collecting it. And then, so don't come to me butt naked, you know what I'm saying, with nothing. Come to me with your first attempt, bring it, and let's see how we can improve on it. So you already got something that you're working on, you know what I mean? So you got something that you're working on.
Yeah, no, I totally understand. It's funny, you're making me think about, often in my personal life, I have to remind people that, like, my degree is in psychology, not psychiatry. I can't read your mind. You're gonna have to give me something to work with. You're gonna have to give me something to work with. Then I can go from there. But I can't read your mind. My name is Sherman, not Cleo.
Yeah.
I can't predict the future or read your mind. So no, you're absolutely right. And I think that's a great place to start, because I think a lot of people talk themselves out of even making the approach because they get too intimidated about, well, what question do I ask, or what do I start with, or what should I do? And honestly, you're saying just do it, and then whatever you're doing, we can build from there. So I think, like, that's definitely important to remove people from that barrier of having research be something that's intimidating. So
Yeah.
yeah.
And people have to recognize the importance. People and organizations got to recognize the importance of collecting that data to tell your story. You know what I'm saying? A lot of folks, they'd rather be in the streets doing the actual physical work and be
Right.
like, yo, I ain't got time for the paperwork. Well, you know, I'm a social worker, big bruh. Yo, if you ain't right, it ain't happening.
Bingo.
It ain't happen. If you ain't collect it, it ain't happen. You know what I'm saying? So people have to understand how important it is to record your activities and the stuff that you're doing, and that's what the data is for. And then if you're gonna fall into that trap and be like, yo, what I'm doing physically is more important than the paperwork, then stay out there physically, then forget the paperwork. But understand that without the paperwork, don't nobody know what you're doing. And then you can come up there with every participant that got a great story about how great you helped with everybody got a great story. Everybody got a great narrative. But at the end of the day, how many other people did you help out like this, right? Like, this is a great story, but shows how many other numbers that you actually serve. And that's why you collecting those names and those ages. So you can tell, yo, these kids all signed up with me. You know what I'm saying? They all signed up. You know what I mean? So, but yo, like I said, man, you gotta feel like the data is important. You gotta feel like being able to tell your story is important. If you don't feel like telling your story is important, you feel like being out there in the action more important, go out there, be in the action. Ain't nobody hating on you, but you can't tell the story, ain't nobody believing. And then you ain't got no evidence to demonstrate what you did. So it's up in
That's
the
a
air.
fact. Having done, casework, social work myself, it definitely, if you didn't document it, it didn't happen. And then also, like, if you don't tell the story for you, somebody gonna tell your story for themselves. And usually, if you ain't telling your story, people gonna tell the story in a way that benefits them. And so, again, that's the whole purpose of why we're coming together Thursday. What's that old proverb? Until the lion grow thumbs, history will be written by the hunters. So, like, we're trying to help some of you lions grow some thumbs, be able to write and tell our story. So what can folks expect on Thursday? Because Thursday conversation is going to go deeper than this quick podcast episode. This was a little appetizer teaser. Come back for the entree on Thursday in person. But what I really want y'all to just briefly answer, I guess probably one of the following questions of: what part of Thursday conversation are you most excited about? Or what's one thing you hope attendees bring with them? Or what's one thing that you hope that they will leave with or benefit from coming? And we'll start with Dr. Renee.
Yeah, I'm really looking forward to Thursday, because I'm looking forward to people bringing bringing their curiosity and bringing their spirit for fun. I'm hoping to share a little bit of some of the strategies that I've really learned in community with community health workers and through community health worker training on strengths-based approaches and utilizing living surveys as ways of collecting information in a community-friendly and participatory way. So we'll demonstrate some of those techniques and then talk with each other about how you might apply something like that or other strategies for community-friendly data collection in the spaces and addressing the issues that you're interested in addressing.
Cool. Yeah, I'm definitely looking forward to that living survey activity. That's probably one of my favorite aspects of the community health worker training and facilitating and being a participant. So definitely looking forward to that. Dr. Katie, talk to us Thursday. What are you most excited about? What do you hope people bring with them, or what do you hope people leave with a benefit or understanding of?
I'm looking forward to meeting folks and hearing what's happening. Like going back to, what I've been saying about bring something, write a working draft. I think this make it work for you. I always tell my students this when I'm in class. Like I could sit up here and lecture all day, but that doesn't mean that you're learning anything. Like this is a relationship. Bring to this what you hope to get out of it. Like bring questions. If you've got something on a working phase and we get to the Q&A section, like tell us about it. Like, hey, I got this going on right now. Like, what's, two things that you think would be most helpful for me at this stage? That's what I get excited about. Like when people are just wanting to spitball and brainstorm in a moment, like this is what's going on. How could we work through this? And so that's what I hope people will do, will be engaged and show up and like have something, a working idea, working draft or data. We have, we'll be sharing examples, the work that we've been doing. I'll have an example of like a survey I created for an organization, but really make it work for you. Make us work for you.
Yeah, no, that's dope. Yeah. So when else are you going to be able to have three illustrious researchers in one room with the opportunity to have Q&A with them and go through some activities and see some real live examples? So definitely looking forward to that on Thursday. Dr. Chris, talk to us Thursday. What you looking forward to? What do you hope people bring with them? What do you hope people leave with?
Yeah, so we be having a lot of events in Buffalo in the last 10 years, where we try to introduce the community, to research and to help understand the importance of research. And so one thing, what we want to do differently at the event next Thursday is what we want to do is we want to do a real live example for you of just the introduction of starting an Excel sheet. You know what I'm saying? So I'm going to bring in a survey that I was working with the hospital-based violence intervention program. Me and Big Will, we basically put a program together around trying to explain to kids how to manage a situation when you come around your friend and he got a gun with him. You know what I mean? And then so we basically gave a pre and post test. So what I'm gonna do is I'm gonna explain what the survey is, how we put it together, show you the questions, and then show you how the questions from the survey map onto the Excel sheet, and we make sure all the fields is there. And then we're gonna give an example of how we're starting to collect data on the participants. We putting in the names, the ages, the grade and stuff, and then to show an example of the outcome, and then just to kind of show you in the data how it's looking, and then just to show you. And this is the beginning stage of it, so this is like brand new, and so there's an opportunity for us to show the crowd like, yo, there's us starting our data sheet. You know what I mean? And it's exactly the sort of model that we want to get it for. Like, start your own joint, bro.
Yeah.
Start your own joint. You got a program with kids. You got a program with adults. Whatever. You don't need to wait for me, Renee, or Katie to come over. You know what I mean? And apply for $1 million and wait for thousands of months before we could do something. You can start collecting data now. And the more you collect data and the more you get into the habit of it, then the more you'll be able to get into the habit of collecting more complex data, right? So we're just doing an introduction. And Bam, thank you, man. We ain't up in this joint like trying to make y'all, 30 years of class of school like me, Katie, and Renee did, right?
Right.
We're trying to give you an introduction to show like, yo, this is where you can at least quantify how many people's in your program, get a little bit of information from them, and throw an outcome in there. So we ain't trying to make it too complex. We're trying to make it easy. If folks got laptops or y'all got Microsoft Excel or Google Sheets and you got some data, bring your joints in and then you can play along with us. But we want y'all to leave with at least three learning skills that we're going to teach you on Excel about, how to help manage some of that data in the beginning stages of your data collection. That's what we want cats to leave.
Word, I definitely appreciate that. So if you're watching this, pull up on us Thursday, July 30th from 2 to 6. We'll be over at 63 East Delavan. There's free parking in the Spillman lot at Canisius College. I definitely want to thank Dr. Renee, want to thank Dr. Katie, want to thank Dr. Chris for carving time out of your busy schedules and busy lives and busy days, not only to do this event, which has been a drawn out process. So I appreciate y'all patience as life has happened and resilience as researchers working on this. Just in general, personally, thank you all publicly, but also looking forward to the conversation. I got my own questions and curiosities. So I'm going to try to manage hosting and keeping the conversation flowing without jumping in with my own curiosities. But I encourage everybody to attend. Definitely bring your laptop, bring your curiosities. We're going to have some food. We're going to feed folks, allow for Q&A, networking opportunities, and conversation for you to really get to know each one of these individual research, and hopefully there's an opportunity to collaborate with them and or somebody else who's in this space. So without further ado, I know Katie got somewhere to be, so I'm being mindful and respectful of time. We're cutting it close. If nobody else has anything else that they want to add, I'll go ahead and close out. Anything for the good of the order, folks?
No.
Now we good to go. Only thing, Big Sean, we got to do the exit interview the day after. You got time on Friday?
I do.
We won't schedule. I'll text you. We'll schedule time for Friday to do the exit interview after the event on Thursday.
Okay, cool. See, doing an exit interview is also a form of research. So yes, I'm learning. See, I'm learning in real time. Yeah, see, get y'all some professor friends like me. So my name is Sherman Webb-Middlebrooks, lifelong Buffalo resident, full-time Black man on behalf of the Buffalo Center for Health Equity and the Win Initiative. I want to leave folks in the words of my hero, the late, great, honorable Jerry Springer. Y'all take care of yourselves and each other. Peace.
Peace.
Woo, thank y'all.